In this video series, 3D MedNet is with 3D Life Prints at Alder Children's Hospital in Liverpool. We're talking to surgeons about how 3D printing helps them solve the most difficult of cases. In this first video with Mike Richard, Head of Engineering at 3D Life Prints, Mike discussed how to make a 3D model from a patient scan.
My name is Mike Richard and I am the Head of Engineering for 3D Life Prints. There's been a large amount of development and research that we've done with the trusts here in the UK. In our initial 6-month term with Alder, we were very exploratory and we didn't say no to anyone who requested a 3D print. Well, we've had a number of surgical cases here in the Alder Children's Hospital in the UK where the 3D printed models have been used as a really crucial part of the pre-surgical assessment and planning. We've had a couple isolated cases where 3D prints have then been sterilized and used intersurgically, which have been fantastic examples of how disruptive the technology can be. Okay, so at the heart of each 3D print is the scan which it was obtained from. These will normally be from CT scans or from MR scans, and essentially our segmentation process starts by identifying specific Hounsfield range units within the scan data. So you will have parts of the scan such as bone or contrasted blood which will show up as a very high Hounsfield unit range that allows you to segment out very complex ventricular data, bone data, metal work within the scan. In imaging, especially in pediatric imaging, there are a number of challenges you can come across. Some scans, like MR scans, can take a long period of time, and when you have little kids moving around in a scanner, you can sometimes get loss of detail in scan or sort of a blur, which will eventually affect your 3D model, as the 3D model, for anatomical purposes, is faithful to the scan. Some alternate challenges there would be metalwork or devices that have been surgically put inside the patient previously. These can sometimes interfere with the scanning and cause artifacts throughout your CT or MR scan, which then gets translated onto the modeling and onto the 3D model itself. So steps can be taken to reduce that from the scanning perspective, but it often just ends up being a lot of manual time removing this artifact and working through these specific areas that the surgeons and the hospitals need to see. Well, on average, I would say maybe half a day, 3 to 4 hours of human time spent with the software, getting the scans to a point where they are ready then to either be 3D printed or to be reviewed with the team. In cases where the imaging isn't exactly ideal, this can go on to a day or even several days. I absolutely see this as being something which will gradually reduce through the kind of revolution that 3D printing is having throughout the world in the medical field especially. There are radiology teams which are developing specific sequences which produce better 3D models. And this results in a better scan, something easier to look at, and this can then result in a much better model which would be even more helpful for the teams that would be looking at it.
Thanks for watching. If you enjoyed this video, make sure to check out the rest of the videos in our series from Alder Children's Hospital. Make sure to like and subscribe on Facebook so you don't miss the latest videos from 3D MedNet.